Welcome everyone. My name is Dr. Lucy Ingram and I am an Associate Professor and Director of the online Professional MPH program in the Health Promotion, Education and Behavior Department in the Arnold School of Public Health at the University of South Carolina. My research and teaching interests are in health disparities, particularly in the area of sexual and reproductive health, with the ultimate goal of eliminating barriers to equity. About this course. As you know, and thus are hopefully in the correct place, this course is entitled Race, Ethnicity, and Health, Examining Health Inequalities. I developed this course more than 8 years ago for the terrestrial program, and I'm really enjoying teaching it in the online program as well. I am excited to expose you to the topic, reiterate some information you may already know, and introduce you to new content in the field. By way of the course description, this course is designed to provide a comprehensive overview of race, ethnicity, and health in the U.S. and both historical and more current perspectives of identified determinants of health will be discussed. As appropriate, I will integrate my experience in the field as I find that sometimes help bring key concepts and topics off the page and may make them easier to comprehend. I also enjoy integrating a variety of opportunities to extend the course content beyond the readings and lectures, so we'll point you to videos or films where you can gain additional insight. Also, while this is a distance course and we're not sitting in a room together, I have integrated assignments designed to ensure that you interact not only with me and the course material, if that's an interaction, but also with each other. So let's get started. As a point of departure for this course, I'd like to make sure that we have a common understanding of the term health disparity. So here are some definitions of health disparity. According to the Minnesota Department of Health, health disparity is a difference in health status between a defined portion of the population and the majority. A second definition is offered by Healthy People 2020. Healthy People represents our evidence-based health initiatives for the nation and provides a compass for knowing if we are reaching leading health indicators. You may find more information about Healthy People at www.healthypeople.gov. So, according to the Secretary's Advisory Committee to Healthy People 2020, a health disparity is a systematically, plausibly avoidable health difference that adversely affects socially disadvantaged groups. And finally, a third definition provided in Healthy People 2010 further explains health disparities by the different ways in which one can define them. This includes differences that occur by gender, race or ethnicity, education or income, disability, living in rural localities, or sexual orientation. Health inequality and health inequity are terms typically used interchangeably with health disparities. We see them used most often outside of the U.S., yet they are still relevant to our discussions for this course. Inequality denotes a lack of quality, as in opportunity, treatment, or status. On the flip side, as you see depicted in the illustration, each individual may be given the same or equal lift, but this doesn't necessarily result in the same outcome, particularly if the individuals are different to begin with. On the other hand, inequity denotes a value judgment of fairness and suggests that something is unjust, unnecessary, and avoidable. On the flip side, as you see depicted in the illustration, each individual's quote lift, if there is one at all, is based on their needs or their circumstances to ultimately lead to the same or equitable outcome. As we continue through the course, I encourage you to reflect back on this illustration to see if you come up with different descriptions of inequality and inequity. Health status is another key term that we'll use often in this course. Health status is defined as a measure of one's physical or mental functioning. Access to health care is a key term as well. This is described as the ease with which an individual can obtain health services. And finally, social determinants of health. These are non-medical social factors that influence health and well-being. These factors are shaped by a number of things, including the distribution of power, money, and resources. Examples include income, education, working conditions, access to health care, there's that term again, housing, and food resources, to name a few. So, all of this then brings me to two questions that I would like you to ponder. The first is, why is it important to study health disparities? And then, why is it important to eliminate them? And here are a few reasons that I hope to explore during the course of this term. It is important to study and eliminate health disparities in order to achieve equitable care for all, because minorities will become the majority, and more about that when we discuss epidemiology and demography, because it violates moral and ethical tenets, because it impedes access to quality health care for all, and because it perpetuates injustices. So, in conclusion, health disparities inherently include some notion of injustice, inequality, and avoidability. And as we proceed through this course, I hope to convince you that it is important to study health disparities and ultimately devise solutions to eliminate them.